Hey guys, John here from Titan, and today I want to talk to you about one of our healing peptides, TB-500, or you might know it as Thymosin Beta-4. TB-500 is a healing peptide. This healing peptide is great for a lot of different things, from ligaments to muscles to tendons to joints. It's very good for connective tissues, so like in the shoulder areas or elbows, those knees. It's great for flexibility. It's great for taking down inflammation in the body too as well. And it's more natural than anything else that you're possibly going to do out there. So at that point, if you're looking for something that's going to help you after a surgery possibly, or after a wound, a cut, a burn, these are actually good peptides as far as the TB-500 to use to help you heal faster. And that's what you want. You want to heal the fastest and the best you possibly can. It's very simple and easy. All you have to do is call Titan Medical Center and you fill out the new patient paperwork. You'll be able to see a doctor, a medical provider, and they'll actually be able to tell you about TB-500 and the healing benefits that you could possibly get from it. So it comes from a US licensed pharmacy. It's not coming from a research company. It's not coming from underground. It's not coming from our clinic. It's actually coming from the pharmacy prescribed in your name. And that's very, very big. The reason is because TB-500 is all over. Hey, and we are getting kicked off. If you're with me on Instagram right now, my Facebook's about to launch. So Titan Talk Tuesday is officially going to be in full effect. So I'm just waiting for everybody to catch up. But if you guys are with me, how you guys doing today? Titan Talk Tuesday officially starting. And we're going to go over all kinds of questions you guys had. If you're on Instagram, you didn't get to see the cool intro. On Facebook, they're doing their intro right now where it's Thymosin Beta-4 and Titan Talk. We're going over that because that's a therapy of the week. So I'm really excited about that. It's going to have some great benefits for a lot of patients. And a lot of patients already have benefited from it a ton. So at that point, I get a lot of questions about Thymosin Beta-4 and what it can do for you, how it can help you. And honestly, it can help in a lot of different ways. And the way it does help is basically, with cell formation and migration, basically at that point, proliferation, it helps with the healing process. It helps, hey, what up? How you doing, guys? So it helps with a lot of different ways as far as that goes. Joints, muscles, tendons, wounds, as far as like burns, cuts, surgeries, as far as healing from surgeries. And it's an agile protein. It goes through the body very, very quick, right? And the reason is because the molecular structure of it. And, it's really light molecular structure. At that point, it passes through the body and the cells at the cellular level. That's how it helps heal you. So it's a really, really cool peptide. At that point, you can run it by itself, or you can obviously use BPC-157, which we'll cover next week. I'll make the therapy of the week and kind of let you guys have the lowdown on that. Hey there, thank you for coming to Europe and Orlando this year. I love the shirts. And thank you, Jimmy Wheels. I appreciate it. It was awesome this year. I'm actually going to show those shirts, those Titan Strong shirts, and we're actually going to be giving those away too as well. But Thymosin Beta-4, so very, very cool as far as a lot of different things. There's a lot of studies on it. So check it out. Titan Medical Center does have it prescribed and coming from a U.S. licensed pharmacy in your name. So at that point, you know what you're going to get. I think the therapies are 15 milligram therapies in the vial. So at that point, it can be very, very aggressive. And like I said, TB-500, you can use it by itself or you can use it with BPC-157. I've used them both by themselves. And TB-500 is a little bit different than BPC-157. As far as BPC-157 comes from your body protection, the compound like in your stomach, your gastro tract, those juices, that's where it comes from. Where TB-500 does not, and it's a synthetic protein, basically at that point, a peptide. And what it's going to do is it's going to help heal though. The cool thing about it is it works systematically. So it works, if you inject it subcutaneous, it usually works throughout the body. So at that point, it can work for acute or chronic injuries. So at that point, you're going to be getting a lot of benefits from it. Let me know how your therapy has went if you've been on TB-500. I want to hear the good testimonials. I always say the proof is in the pudding. Happy birthday, Warren, 39 years old. Sorry, big shout out to you, dude. I apologize, guys. So it works for a lot of different things as far as healing wise, and I like to hear the testimonials about it from real patients, because real patients, real results. That's why Titan's around. That's why we're here. Cutting edge therapies to try to give you guys the benefit, the more natural way of healing, with getting there faster. Our body goes through a lot of strain, a lot of stress when we have surgeries or accidents or injuries. And at that point, it can get run down, and we might not be able to give it the nutrients it needs to heal faster. And why not have those benefits? Why not use those things, right? We can use those to our advantage, especially if they're going to be natural in more of a way than the other things are, and it's going to help you heal faster. It's not going to cover up pain. That's an addiction problem that unfortunately our country has produced. Because doctors were told by reps that this was going to help patients get over pain, and doctors felt and empathized with patients because of this. So that's where the opioid epidemic came from. So at that point, they were lied to about dosages and prescribing and how it would affect patients. And at that point, it was FDA approved, right, for that. And look what happened. So at that point, look for some of these other cutting edge therapies that can maybe help you and be non-addictive, and help you in ways that it's meant to. So Thymosin Beta-4 is really, really cool. Thymosin Beta-4 is in research right now to see if it helps with athlete's heart, which is ventricle hypertrophy. That's what it is. So at that point, a lot of athletes have this, and it's just a damaged heart, basically. That's what it is. So they're looking into the studies of this, of possibly helping that. At that point, we're not saying that's going to help that here. I'm not saying that at all. But it will help in a lot of different ways as far as ligaments, tendons, joints, muscles, like I said, burns, wounds. After surgeries, you have those cuts, you want to heal a little bit quicker. I think this is a very, very good route to go. At that point, we've got a lot of questions here. Wow. Hey, I'm diagnosed with low T. Doctor prescribed test gel. How do your different therapies normal, optimal? Okay. All right, so I'll answer this, right? What up, Deke? So Dennis Warner, national judge. Dennis Warner will be at Deke's Mid-Florida Classic. Dennis Warner's Mid-Florida Classic, June 15th, Orlando. Sean Roden, Mr. Olympia, will be guest posing. If you guys are going to go to a show, an NBC show, this is definitely the one to go to. Titan will be there in full effect. I can't wait. All right, so let's answer, I think, Brooklyn James. All right, so I'll answer this question. All right, so if you were diagnosed with low T and then you're on this testosterone gel, right? How does our therapy differ? All right, so usually a lot of our patients, they're going to go on injectable therapy. Now, 7 out of 10 patients have never done an injection before in any way, shape, or form. And they might be scared, right? Or they might never have done it. And at that point, it's like getting over, that first hump. Once you get over it and once you do it, you're going to get a lot more benefits out of it. Now, testosterone gel, where a lot of patients do transfer over that were getting testosterone gel and they were getting it covered by insurance. I've seen the ones that you rub on your scrotum. I've seen the ones that you rub underneath your armpits. I've seen the ones that you can pretty much rub everywhere on your body. So at that point, now, here's the thing. The effectiveness. How much was prescribed in the percentage, right? 2, how much was absorbed, because different parts of the body will absorb different amounts. And especially with us guys being a little hairy, if you're hairy, all that gel is not going to be absorbed. So at that point, you're going to have to look into that. What did your levels come back as? Your free and total testosterone levels, your estrogen levels, right? And then how are you feeling? Because that's the big thing. You went there because you want to get rid of symptoms, you want to feel better, or optimal. So at that point, let's say your blood, you're free and total, right? Your total comes back, and the normal range between 216 and 946, big range. You come back at 300, right? You're on a testosterone gel. Well, that's not really good, right? You're just barely in normal range. Your doctor's gonna be like, well, you're in normal range, everything's good, everything's fine, everything looks good here. These numbers are right in the range, so you're normal. Now, why are you doing this therapy? You're obviously doing this therapy because you want optimal results, right? And that's kind of where you want to get. I explained it to somebody today that kind of told me, they came back 5 points over what was normal at the bottom of the range. So let's call it, if it was 216 to 946, he came back at a 221. And at that point, his doctor said he's good. Now, he's trying to lose weight, which naturally he lost 95 pounds. Great. Awesome. But he wanted to do more. So at that point,
I'm like, well, your body's still at that low end, It might be like maybe like, and he was 45 years old or something like that. I said it might be like a 6-year-old normal range, right? It might be. I'm not a doctor, so at that point I told him, I said, you might want to get it checked out or second opinion. At that point, when you optimize it, and let's say you get to 900, you're at the top of the range, you're not over the range, you're feeling good, the symptoms are going away, you're getting more erections, clarity of the mind, you're losing body fat and getting lean body mass as long as you're doing the right things. You can't go out and eat like a pig, excuse my French, and expect to lose weight, right? You got to eat right too. So at that point, if you're doing everything like that, you should be getting optimal results. And you're bringing those numbers back to when you were younger. That's why it's an anti-aging type therapy. Because when you were that age, hopefully your numbers were, at that higher range. Let's say 600 to 900, right? And at that point, your free was getting utilized. It was good number. That's where you were feeling your best. That's when you think back like, man, when I felt my best was probably my 20s or 30s. Because your levels were probably higher. That's why you felt better. That's why you looked better. It's a thing. We deteriorate through time because of our hormones. It's like a flower. We wilt. So at that point, you want to make sure that you're taking care of yourself and you're making sure that your levels are all optimal and in healthy optimal ranges. Nothing crazy overboard. You don't want estrogen high. That's another common thing that I see with gels. They go to primary care or they're getting an injection from primary care and they're not checking their estradiol levels. So at that point, when they're not checking their estradiol levels, their estrogen goes very, very high. And they're getting water retention, irritability, fat deposits, possible gynecomastia, and then they're just like, man, why am I doing this? I'm not getting any results and I look worse. What's going on here? I don't feel good. Why? Everybody I talk to says, this is the best thing since sliced bread. HRT, TRT, I'm doing it and I don't feel good. Well, that's why. And there's a lot of different things. So you want to go to somebody that knows what they're doing. A lot of doctors and primary cares are starting to try to get into this because it's such an epidemic. And I call it because 7 out of 10 blood tests that come back male and female with us, and we don't take blood here. We send them out to a professional lab, and they come back and they are lower deficient. And that's both sexes. And it affects both sexes. So at that point, it can affect the relationship, their jobs, whatever they're doing. And we really want to take that in consideration because that affects other people. Somebody that's working as, let's say, a loan officer, and he's in a real bad mood that day. He has low testosterone, he's depressed, he doesn't feel good. And at that point, like, you come in for a loan and he could have possibly given it to you, maybe not. It's a judgment call. That's what I want to get at. And at that point, if people are in better moods, they might help more people out. And that's a big thing. All right, so I hope that answered you. So we want optimal levels. We don't want to just get you over the normal range. Brooklyn James, I hope that answered your questions, okay? If you have any more, let me know. All right, what's the name of the peptide for healing? So, Black Baby Buddha. So TB-500 is the one we're talking about. That's the therapy of the week. TB-500. Also, it's structured and is known as Thymosin Beta-4. The other one was BPC-157. That'll be probably the therapy of the week next week, and we'll talk about that. And we'll talk about the combination of using them both. They both can work by themselves, and they both work in a little bit of different ways, and for some different things. So whatever you're trying to accomplish, that's why you're going to go through a consult, because you're going to talk to our doctor, you're going to fill out your new patient paperwork, and there might be something in there that our medical provider sees that could help you out with one of these therapies, right? And at that point, you can make a good educated decision about what therapies you possibly want to do with Titan Medical Center. And we offer all these therapies doctor prescribed, monitored, and it comes from a U.S. licensed pharmacy in your name. Okay, so you know what you're going to get. Sterility testing, endotoxin testing. These pharmacies, they're regulated. Okay, so at that point, they're not coming from us. They're not coming from our name or anything like that. They're coming from a real licensed pharmacy. All right, so went over that. I was just thinking about it. Cool. Thank you, guys. Amy's Therapy Cream working wonders. Okay, so for females, all right, this is a big one, is what do we do for, let's say, a female if they need testosterone replacement therapy? Now, this is a big one, and I've seen doctors all over the country do different things for this. Unfortunately, I see a lot of patients coming from these doctors. And at that point, there's some good doctors out there that do some good things. Now, there's different ways to administer testosterone replacement therapy for females. What is it? Because I'm bringing this up because Pat, Amy's on it, which is, his girl. And at that point, she was low. At that point, she's feeling better on it. He's probably, getting the benefits of it. So let's bring it up. So there's an oral version, which is a troche. That means an oral lozenge basically. It goes sublingual, and that's how you absorb it. Very good absorption rate. We have patients on that, female patients. It works great. They can take it with them anywhere and basically put it in, and nobody knows, okay? And you can split the dose of it and have a great day all the way through. No ups and downs, okay? The next one, there's a cream. Now, some females like the cream, and it works better for the cream. The real way to tell is through numbers and blood testing and how they feel. So at that point, the doctor will take all that information, and we listen to the patients. Sometimes, things need to be adjusted or tweaked. That's why it's a personalized therapy regimen program and not a cookie cutter program. All right? It's not one for everybody. That's not how it works, okay? All right, so the third way is by injectable. Now, injectable we do not do here for patients. And the reason is injectable is fast transportation, higher absorbency, and to get an injectable, let's say it's a 200 milligram per ml vial that a normal testosterone guy gets. Well, at that point, if they take just a little bit of that, you're talking about 20 to 50 milligrams. It just depends how much they get and how it absorbs and how their body is. But at that point, their numbers skyrocket. So we see some of these females come back at 300, 400. That's a man's normal range, okay? That's pretty serious. Now, some women, they don't care. They get some of the benefits like the libido enhancement, the lean muscle mass. There's a lot of different things that you can get benefit-wise. It's a masculine hormone, right? So at that point, you will get some of those benefits. Now, there's a flip side to that. Some of these females will get negative side effects. The negative side effects are hair growth in different places or areas, just like us guys. Before I started testosterone replacement therapy, and I started, it's been 10 years for me, so I was 28. And at that point, I never had a hairy back. Now I have to shave my back, okay? That's one thing. It's just different things. So females, they usually get it on their lip first, and they usually get a lot. Deepening the voice, clitoral enlargement. There's some negative things that can go along with it. So it just really take caution and what you're doing. If you are doing an injectable as a female, just make sure you're monitoring. Make sure the levels aren't getting too high. That's really a really good point for you guys, and a way for you guys to monitor it or your doctor monitor it. I'm not against it at all. There's different things for different people, and like I said, the way they feel and stuff like that should be the most important. So I never disagree with anything like that. And doctors, if they wanted to do that, then hey, all to them. All right, so what we got here? I need blood work ASAP. So Black Baby Buddha, call in, right? Get the blood work, mention this, and you will get a discount, man, okay? Cabergoline for adrenal cortex stress. All right, so our doctor, I don't think, would ever prescribe cabergoline for that, right? And I haven't done much research into cabergoline doing something for that. So for adrenal stress, so I would do Titan Ultra, the NADH. Look into that. It's more of a natural way to do it too. It's awesome for like adrenal fatigue. And I know that's a big thing out there is adrenal fatigue. People talk about it all the time. So look into that. As far as concentration levels, a lot of different things that NADH does, and what it's paired with in that injectable is awesome. I don't want to bore you with too many of the therapies and go into in depth with, but that's really cool. Do you have anything that clears allergies? So yes, more limo. Look into glutathione. Glutathione is awesome for allergies. All right. So I have a lot of patients, especially myself, and I get really congested, I would say, especially during allergy season, and I have to take a Zyrtec almost every day because of it. But glutathione will immediately, it helps clear it up. It boosts the immune system. It helps in a lot of different ways. So allergies, I would say that's really the way to go if you're looking for a more natural route. Glutathione, I take 200 milligrams per ml almost every day or every other day. It definitely helps me, and I definitely notice a difference. Especially, when I was sick, and when I do get sick, temporarily sometimes I will get sick. But I'll take glutathione, and I usually get really congested and sinus infections. And at that point, man, they work wonders. It works wonders when I take it. So I try to take it twice on those days. Why does higher doses of HGH cause water retention? All right, so you're talking about edema. So at that point, basically, your hormone levels are off to a certain degree. Your body's compensating. And at that point, you're going to get edema in the legs. And that's not everybody. So a higher dose of HGH for one person can be 8 IUs. Another person can take 16 IUs and be fine. So at that point, and that's a lot of HGH, guys. I mean, at that point, and we don't even do HGH here. So real HGH, it's very expensive. It's not supposed to be prescribed for anti-aging, medicine, sports medicine, or anything like that. And anybody that's doing HGH, I'd highly, highly worry about. That's why you don't see too many clinics. They would be advertising to the winds that they do HGH. And there's thousands of clinics across the United States that do HRT. And you don't see them doing it. There's a reason why. It's not because we don't know HGH is really good. It raises IGF-1 levels. It does have some benefits, but it has a lot of negative side effects, and the DEA does not look good on HGH, especially for not using it for what it's supposed to. And a lot of drugs get used for off-label use, right? But especially that one in particular, it's a no-no, man. So at that point, IGF-1 therapies are pretty good. GHRH therapies like CJC 1295 with Emperellin, it's a GHRP kind of. In light, it's replacing GHRP2 and GHRP6. Those combinations together work really good synergistically to hit the posterior and anterior of the pituitary. So it's really, really good. MK677, that's been really, really good. I was with the nurse practitioner today, and we were kind of looking at more and more studies behind it. It's really, really cool, and it's really the older people that they did the studies on it and had the great effects with, especially in raising the IGF-1 levels. I mean, it was really, really cool. We've got some good patients that are on it. As far as that goes, it's a better option financially with some of these patients, and for long-term use. Because taking growth hormone for long-term use at higher doses could possibly, shut down your pituitary and you produce your own natural growth hormone. Then you're going to be stuck. At that point, you're going to be like if you want testosterone replacement therapy and shutting down your access, right? At that point, you're not going to be able to produce. And you're going to feel the negative effects of that. And it's not going to feel good. And your body's going to take a dump and dive. That's what happens, man. It crashes. So I hope that is good information about that. What else we got here? What's going on, brother, from Chicago? Yeah, that's my guy, man. Midwest best. I love Chicago. It's my home city. All right, I'm 6'5", 270. I'm told that your product may not work for me because of my size. I'm told it will make my rage. What? Whoa. All right, so Team Sonia. Who is telling you this information? I know nobody in my office said this. Your size has nothing to do with anything, and I have bigger people than you. Big Drew is like 6'6", 300 pounds. Rodney's like, I don't know, 6'4", 250, 260, I guess. I've got Jeff Culp. I mean, I've got some big dudes. So I don't think that, and then patient-wise, we have big dudes. So we service everybody. So I don't think that it's not gonna affect your rage. Okay, that's another myth. All right, let's cover this, guys. I want to cover this stereotype. They see a guy that has muscles, somebody outside. That guy's on steroids. That guy's gonna go in a rage, a steroid rage, a testosterone rage. All right, so let's just clear the air. So testosterone does not make you aggressive. I guess it can make you a little aggressive, right? Testosterone's a maximum hormone, but it's not going to put you into a roid rage. That's my point. Not aggressive, because it should make you a little bit aggressive. That's, a man is a little bit of aggressive. So at that point, it's not going to make you overly aggressive, and it's not going to put you in a roid rage. Actually, an imbalance of hormones with your estrogen going high, okay, can throw you into a rage. It can make you short-tempered, right? Very irritable, very fast. Anything can just snap and put you off. So getting that in check and everything in balance, harmonic balance in the body, you should be feeling the best. You should have a smile on your face. You're usually more calm. I mean, listen, guys, I've been on this therapy for 10 years. I don't rage out, I don't go crazy on people. I guess, unless they would really, warrant it, somebody's trying to hurt my family, something like that, I guess, you do what you got to do. But, at that point, a normal everyday, like you're in the office every day, right? You're seeing people, and there might not be people you like, but you still got to work with them. It is what it is. So at that point, you can control yourself. It is about self-control too. And I've seen people that are not on any kind of anabolic steroids or testosterone and rage out on people, kill people. I mean, look at all these people that, these murderers. They're not on testosterone. These guys are some little pukes or women that are like 5'5". I mean, come on. So at that point, let's really think about this. Don't stereotype people. That's the worst thing out there. I see it all the time, and it's really not cool. Just in any way, shape, or form. We shouldn't be shaming anybody. And no, you're not going to rage out, so don't worry about it, Team Sonia. That was pretty good, funny though. I get it all the time. All right, Brooklyn James, my man. If I take glutathione, should I take a break from here and there? Also, can I pre-refill my syringes a few days beforehand and leave in the fridge? Okay, so glutathione. You can take it here or there if you want. You can take a break. It shouldn't really do anything if you don't take a break. But yeah, I mean, I guess if you want to take a break, you can. Or you can go every other day or something like that. It all depends on you and your schedule. You can pre-fill some syringes, for the day and leave them in the fridge. I do that kind of like right before I'm going to take a trip, and I have a bright red eye flight out, and I'm going to fly out early. So the night before, I'll get like all my syringes ready when I'm going to inject that morning. And as soon as I wake up, they're all ready to go, and boom, 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 boom. Now, would I do it, like I've seen one person get a 30 ml vial of, I think it was like Titan Complete. Draw out 30 shots of the Titan Complete and leave it. I don't know if I do that. I'd leave it in the vial. I mean, it's better. The reason is because some of those will lose concentration with direct sunlight, and that's why they're in amber vials and not clear vials. And at that point, you don't want that, right? You want the highest concentration. You don't want anything to lose concentration when you're injecting it. So make sure, you just keep it out of sunlight, you keep it in a fridge, dark area if you're going to do something like that. If you got to travel and stuff like that, I wouldn't recommend it. I'd keep them in the vials. But yeah, you can do it a couple days. That's not a problem. I don't see it being an issue. Cortez Fitness, what's up, man? Make me rage. I'm told by a former Marine you will not rage. Well, I don't know, man. I mean, listen, I'm not going to say you're not going to rage, but it's not going to be because it's testosterone replacement therapy. I promise you. What's up, Jay? All right, so yeah, that's really, really good. So what else do we have on here? And I'll start doing it. Oh, Jeff Cremona. Mark, what's up? Steve Rivera. Phil Westcott. Man, we got some good guys. Neil Berner. My dudes. Carlos. What's up, man? Man, what up, Stacy? All right, so that's really, really cool. All right, so let's answer some questions here. All right. So some questions come in, and I try to answer these questions, and I want to answer them fully. All right, so how do I get started on getting healthy and fit? This is a question that we got back from a newsletter. So how do I get started on getting healthy and fit? So this is a pretty basic answer. Basic answer is one, and I know you probably heard it a million times, start eating correctly. And I'm not going to say do a shock type diet where you throw out everything at one time and you're eating, carrots and lettuce and a little bit of chicken breast, right? Make sure you have some variety if you need variety. That's one thing. Look for better choices in foods that you're eating right now. And get rid of the soda. Get rid of the pop. The reason I say this is I see a lot of people compensating for regular pop or soda. Sorry, I'm from up north, so I say pop. But soda is what they say down here. So soda or diet soda. Then they go to diet soda. Guys, you're still getting a lot of sugar out of that. I don't care what they say. You're getting different things out of there that you shouldn't be intaking in your body and are probably going to halt or slow down your progress, okay? So make sure that you're looking at that. Look at the back of the labels of foods. Now, I looked at some of these other things. I think it was Mother's Day. My mom came over to make me pancakes, right? And I don't eat pancakes that much. But when my mom makes me pancakes, I'm going to eat them because I don't get them too often. So when she brought out the pancakes, I told them beforehand, listen, give me some syrup that does not have high fructose corn syrup, that's organic, something like that. And she tried her best. She got me this stuff, and it said no high fructose corn syrup across the big label. But on back it says fructose corn syrup. I mean, dude, it's just another way for them to just store in the bottle. At that point, look at the label. So eat right. As far as that, listen, stick to your basics. Stick to your proteins as far as chicken, your beef, your fishes. You should like one of those, okay? At that point, add some lettuce in there, add some vegetables of some sort. I don't like broccoli, I don't like asparagus. Those are very good, healthy choices. So I would never steer anybody away from that. Everybody's different what their diet is, but you gotta fit those good things. If you don't like any of these things, you gotta change. Incorporate one or two of these things at a time. Do it by week. At that point, by week 4, you should have some meal plans for yourself that you can eat on a regular basis and change it up. If you're going to have some carbs, white rice. I'm a white rice guy, and they say brown rice is healthier. Okay, at that point, white rice is good for me. Some potatoes, roasted potatoes. Try not to put any butter on there, a whole bunch of salt. That's a big thing. You don't want a whole bunch of sodium content. I'm trying to think what else. At that point, you're going to stick to that. Big thing. Water, hydration, key, weight loss, your organs, everything in your body. Your body is made up of a majority of water. It needs water. Give it water. I hear some people, they tell me, I don't like water. What do you mean you don't like water? Your body's made of water. You need water. What are you talking about? So at that point, get some water in your life and don't go spraying the color flavoring in all your water. I see that. I'm like, man, keep it out. You guys, drink water. And if you guys are drinking BCAAs or whatever it is with your water, I'm not going to say anything about it. We'll do injectable. I think that's a lot better. But if you're doing that, separate your water. Regular water. O2. HO2. Water. H2O. H2O. I'm out of it. All right, so yeah, that's what it is. Water, all right? All right, do normal doctors test for everything? So we're talking about lab work here. So lab work, normal doctors usually don't test for the in-depth testing that we test for. So they usually test you for like a CMP, which is a comprehensive metabolic panel. And that usually covers like your electrolytes, your liver, your kidneys. They usually do like a complete blood cell count, possibly, if you're sick or not. That's white blood cell count, red blood cell count, hemoglobin, hematocrit. They'll usually test possibly for lipid panel, and that's like your cholesterol, so your good cholesterol, like your HDL, your LDL, which is your bad cholesterol, usually like the ratio in there. That will tell them a good amount. With glucose levels on the other end as far as that. That's kind of what they look for. If you have some other issues going on, if you're complaining about things, they might add some tests like thyroid tests. Usually they're not testing for free and total testosterone levels, estrogen levels, progesterone levels, IGF-1 levels, and B12. And that's another thing. If you're going to another HRT clinic, look at what you're getting tested for, right? Compare the price to what we do and compare the labs. I guarantee we're going to beat everybody out. Apples to apples lab testing for the price, guaranteed. And if there's one test you need on there, we'll concierge and a la carte that test to you. So there's a lot of people that aren't running IGF-1 levels, but are prescribing IGF-1 or whole human growth hormone or something like that. So at that point, how do you get a baseline? How do you know where you went? Where were you at before? So at that point, it's a very vital test, especially if you're going to get prescribed a medication that is going to supposedly bump this up or help that in some way, shape, or form. So at that point, make sure you're getting a baseline of all these tests, especially if you're going to go on a medication that's going to bump these levels. You want to know where you started from, okay? Because if you test 3 months down the line, you're through the roof. All right, I'm through the roof. Well, where'd you start? Maybe you weren't that bad and maybe you didn't need to. Who knows? I don't know, you know? I mean, at that point, we really want to know that. So, yes. So when a doctor says they test for everything, ask them, what am I getting tested for? And on your lab requisition, it will have all the tests listed that they're going to prescribe for you to get tested for. And at that point, you're going to be good to go. Now, when you get those lab tests, when you go in and he tells you the results or whatever it may be, make sure you ask them for a copy of your lab results. The reason you want to ask them for a copy is you want to keep track. You want to know where your lab tests are at. Even if you don't know what all those numbers and those tests mean. You go to a medical professional, and I guarantee they're going to be able to tell you. Or if you ever transferred care to, per se, Titan Medical Center, then we have those tests. We know where you're at. We know where you're going. We know what's going on. And you're not explaining it, thinking about it, maybe missing something, and us having to get the records again, or whatever it may be. Plus, you keep a track record of what's going on, and you can track your progress of where your health is and where you're going to be able to, maximize maybe some things, or maybe be preventative about some things, or maybe find out about what's going on and maybe be preventative in helping yourself in your health. So at that point, get a copy, hold it for yourself. If you need to pass it on to another medical professional, or if something happens, you have it, right? And that's the best thing. Have it for yourself. All right. Are Titan therapies safe? Okay. So I want to cover this. Titan Medical Center therapies are very safe. Titan Medical Center therapies are doctor prescribed and come from U.S. licensed pharmacies. What does that mean? That means that the only way that you can get these therapies is through doctor prescription. The only way that they're going to come is when the doctor writes a prescription to the pharmacy ships directly to you. We don't touch these medications. We don't own the pharmacy. We don't make any of the medications. We don't hold medications in office. We don't have our name on vials. So at that point, that should be a red flag to you. If their names are on vials and you're not being able to check this vial that came with a pharmacy, then you have a problem. I can't own a pharmacy and you call me up and ask me, where did my medication come from? Well, we have our own pharmacy. No, it doesn't work like that. It doesn't work like that. If you call up, obviously it's going to be on your vial anyway. So patients of ours know when they get their vial or prescription, they know what pharmacy it comes from. They can see blatantly right on that. So at that point, they know. If there's a question or you don't know and it just says like a clinic name or type medical center on the vial and on the outside, and you're like, well, where did this come from? I have no idea. You call up, well, we own the pharmacy. Titan owns the pharmacy. Well, that doesn't tell me anything. And that's a no-no. So at that point, if you got things like that, it's a red flag. And I definitely would bring it up into attention. All right, so what else do we have on here? I'm going to order some more. Does test raise iron, cholesterol, or blood pressure? All right, so test. So testosterone can raise, obviously, red blood cell count, hemoglobin, hematocrit, any androgens you can. So at that point, you do want to monitor those things. Now, as far as blood pressure, I guess maybe at a higher dose of something could possibly raise the blood pressure. That is, usually high estrogen levels raises blood pressure after somebody's been on hormone replacement therapy, and they can kind of kick it back on testosterone. Now, I'm not going to say testosterone doesn't raise blood pressure because honestly, it might possibly raise some blood pressure. So I don't know at that point, and I don't want to say that because I don't want to be wrong. Cholesterol-wise, it should help cholesterol levels. So at that point, it should not be a harmful effect on cholesterol. Now, aromatase inhibitors, on some people, it can affect cholesterol. So we do want to monitor that, make sure that's correct at that point. But for the majority of patients that use aromatase inhibitors with us, HDL and LDL has not been affected very much as far as that goes. I mean, I'm patient zero. HDL is great. LDL, and I eat steak every day, at least 2 meals, 2 8-ounce fillets, and a couple of potatoes every meal or rice. And I'm very regimented. So at that point, I've been going on for 2 years. I get blood tests every 3 to 6 months. I usually post my results up so you guys can see, I don't just talk about it, I live it and I show it. And that's important, guys. If you guys are going to do this, or HRT or anything, HRT is for health. It's not for working out. It's not for getting jacked up. It's not for being muscular. It's for healthy living, looking good, performing good, and having a better quality of life. That is what hormone replacement therapy is made for. It's been corrupted in some ways, shapes, and forms, and it's given us a bad black eye, I guess, in the whole industry. So at that point, I want to make sure that we bring to light some of these things that are going on, and we get back on track to really help people and to make sure that they're getting the right quality of care. They're seeing medical professionals. They're getting Class A, first-class therapies from real U.S. licensed compounding pharmacies or real pharmacies like Walgreens. Some of these guys are getting it from, or CVS, or whatever it may be. I want to make sure that we're keeping track of these things. And we progress to a better future, right? All in together. All right. I've been taking 0.5 cc's a week from Testosterone for past 2 years. I got to a point where I stopped getting progress since last year. Last week, I had my interview with the doctor. She said she couldn't prescribe me a higher dose. Okay. So I'm just, and I don't assume, so I'm asking, was it a 200 milligram per ml vial or 100 milligram per ml vial, and that you were taking the 0.5 cc's and you were taking it twice a week? Are you on aromatase inhibitor? Have you had your estrogen tested? Have you had your vitamin D tested? That's another big one, guys. HCG, are you on HCG right now? That's another question. So give me the answers to those. I'll try to help you out. Now, increasing the dose shouldn't really do it. Now, if you've hit a plateau, per se, in the gym, I got to ask you the question. Are you eating right? Are you training? Are you sleeping? Even sleep, that's a big one. Your body repairs itself in sleep, right? Especially if you're getting that trans 5 sleep, it helps repair it. You grow and you gain during sleep. If you're not getting the sleep, you're not getting ample sleep, it doesn't matter. You're putting your body through shock and breakdown, and you're not giving it what it needs to rebuild back up. So at that point, that's another vital part of it. So you gotta make sure that's good. I'm 25 with estradiol level 33. Is that high? Now, is it high? So a 33 can be different on different labs. So if it's LabCorp, it's usually up to, I think, 42 or 44. I can't remember exactly what it is at that point. So that's not really, it's not over range. It's not bad. Usually we like to see people between 15 and 20. At that point, maybe, and for you, have you tested an estradiol sensitive test? Now, that's another test that we're going to start doing for patients if they're having estradiol problems or estrogen issues. Estradiol is a good test. It really does. It marks where the estrogen is at that point for the E2. But estradiol sensitive is more specific. So at that point, for people that are having problems and getting them dialed in, we possibly will be running that test for you guys. So that's a test that you should definitely run, man. All right, so 200 milligrams, all right, and HCG, 2 units every day, and estrogen blockers. All right, so by 2 units a day, you mean 20 units? And was that an 11,000 IU vial or a 5,000 IU vial of HCG? The reason I ask this, too, is because, different places will be like cookie cutter stuff. Oh, we're going to give you 2 months of medication. Oh, man, I only have to pay for 2 months of medication. It's going to be cheaper. It's going to be this. Guys, you're getting less medication, okay? You're getting less dosages in some of these vials. It doesn't matter if it's 20 units here and 20 units there. How much milligrams were in the vial and how much does it break down after you're diluting it? And at that point, you're injecting the 20 units. It can be a lot of different things. Does Nectar of the Gods have the same amount of glutathione in the vial as glutathione? No. That's a good question. So Nectar of the Gods has glutathione, NAC, arginine. It's got a lot of different good stuff in it, right? But it only has 60 milligrams, I believe, of glutathione in it. So at that point, it's more of a daily maintenance type thing where glutathione by itself is 200 milligrams per ml. So at that point, that full ml is getting 200 milligrams of you. So it's a lot more glutathione. And if you're sick or you're trying to recover factor and stuff like that, or the allergies, you're probably going to want. I've heard some patients and they do use the nectar for the allergy portion, but if they're sick, hangovers, just feeling run down, they want to boost their immune system, it's usually the straight glutathione, 200 milligrams per ml. Okay. Quest, I don't know what their levels are in the labs. We do use Quest, but I can't remember what their estradiol levels are. See, that's what it is. So 5,000, this is another one. So you're getting the 5,000 vial of HCG and you're injecting 20 units. All right, so at that point, the HCG could be a little bit of a factor. Are you injecting that? You inject that daily? Per day, right? Okay, so you're injecting that daily. So, at that point, that could possibly help out in some factors. Now, like I asked you before, you're eating, sleeping, training. Are you doing all these things? And be honest, because that's a big one. All right? Is it a good idea to order testosterone supplements online? Do I get what I Okay. All right, so I want to show you guys the giveaway. I'm going to give away 3 of these shirts today. And they are the Titan Strong shirts. You guys probably seen these online. I just got the new batch in. They've got the cool Titan Athletic logo on the side. If you guys can see this, the nice little Titan Warrior guy on there. Right? This little spear. Yeah, and guys, there is no other alternative. And you got to have Titan loyalty, all right? That's what it is, all right? So this is the Titan Strong shirt. You're going to be seeing a lot of these. Or a lot. So they're going to be all around town, all around the country. Get ready. We're coming at you. Titan, baby. Be Titan Strong. I promise you, you guys are going to love it. Guys, we have so many shows and stuff like that. I want you to sign up for the newsletter. 22828. Text Titan Medical to 22828. At that point, you'll get on the newsletter. Now, for the shirts, hashtag Titan Strong. You're going to text this to the 727-389-3220 number. Hashtag Titan Strong. We have these, I think, in every size. So you guys are going to be good. You guys are going to be able to support this. It's a beautiful V-neck. You know we do first class. The material is so soft and so breathable. You'll want to wear it everywhere, I promise you. And when you do get the shirt, take a picture of it with it on. I want both sides. I want you to take it front and back. Show your support. Show your love. And maybe I'll do something else for you. You never know, right? I definitely want these to get out. All right, check this out. So let's get into some of these questions. I'll answer some more of these questions. Man, this is really, really good. Man, I wish I could help. I got some people from Dubai here. So Julio, we're not servicing Dubai yet, but very shortly, hopefully, we will be able to service Dubai. Angela, great question. Why drink BCAAs when you can inject them? I love these questions. So, it's a common one. A lot of people are in the gym, they got these jugs, or I say, hey, listen, how are you getting branched chain amino acids? And first of all, some people don't know what branched chain amino acids are. So they think it's a whole bunch of these different things. Well, branched chain amino acids, there's only 3. The BCAAs are, right, leucine, isoleucine, and valine. Those are the 3, and only 3 branched chain amino acids. So, for these, if you're carrying around a jug all day and you're drinking them, listen, I used to do this stuff through GNC and stuff like that way before. I'm talking about 15 years ago. I know what it is. So, I go and I drink this. Man, I feel bloated. I have to go to the bathroom. I mean, all kinds of different things, right? At that point, when you can inject these, right, you're getting a faster transportation rate and a higher absorbency. That means you're going to get better optimal results. You're going to get better desired results. You're not going to have to carry on the jug all day. You're not going to be bloated. So aesthetically, hopefully you'll look better and leaner, right? And not have to worry about it. So you won't have to worry about it. You won't have to worry about it dumping over. You don't have to carry it all the time. People are going to be like, what are you carrying? Well, these are BCAAs. Man, I've had to do that all the time. What is that? What is that? What is that? So at that point, you'll save time on questions too. And you'll get better optimal results. And like I said, higher absorbency, faster transportation rate. You know what you're getting. That's another big one because you don't do some of these supplements. It's crazy. I mean, if you see all the lawsuits from the supplement companies, it's ridiculous. All right. Shout out to Panama City. Just saw someone out here rocking a Titan shirt, a red one. Awesome. That is awesome. Guys, if you guys have Titan gear, please take a picture, tag us. All right. Facebook, Titan Medical Center. Instagram, @Titan Medical. Guys, I want you all to keep it locked. Now, I'm going to give away one more thing. I'll give away the gift certificate. # Titan Gift. Text it to 727-389-3220. All right, guys. At that point, on the newsletter, I might be doing a giveaway through that newsletter. Kind of get you guys more interactive to that. That'd be cool. Maybe some giveaways and stuff like that. So keep it locked and tuned. I'm going to have a Memorial Day special next week. So guys, get ready. Ladies, get ready. I am going to pump it up. Summer's coming. Beach is coming, pool's coming. Guys, it's time to get it right and tighten up. All right? So, if you guys are on YouTube, please press subscribe or go there and press subscribe. All right, guys, I'm John from Titan. I love you guys. Thank you for tuning in. I appreciate it. Any questions you got, DM them to me, and I'll bring them up next Tuesday on Titan Talk. All right, guys, I love you guys. I'll talk to you later.